The core question is, do we believe, we Americans believe, that everybody must have health care? Is that a national imperative? Okay? The presumption, I think, of Obamacare is that it is, if you agree or not. All right, if the goal is universal health care, the British system is a potential model. The free at the point of use certainly gives everybody free something, and it's relatively inexpensive administratively. Works pretty well for the majority of patient visits, maybe not at the top end. Maybe, thank God I've never had to go to a British hospital, but I've had relatives. I have had some relatives who were very sick, my parents, cousins, brother-in-law, and so on. And I have to say they received pretty good care as far as I could tell. Not obviously worse than care that we've received over here, although, as the statisticians would say, an N of 2 is not very much. Okay. So the single payer can lead to cost savings because of lack of bureaucracy and monopsony. But would Congress ever resist the lobbyists? Because that's what you need to have real monopsony. Well, the drug example says probably not. Probably not. But the government is involved, no question about it, and it can now justify coercive control of citizens' health-related habits, smoking, drinking, diet, exercise, Lord knows what. See Bloomberg, okay? How big a Frosty you can order or whatever. And this, I think, is a key point that we should all remember. Free health care, once here, is here to stay. Once people have this, as they do in Britain, it's irreversible. Now, maybe that's good. If you believe, like Mr. Luce, that everybody should have free health care, that's good. If you believe it's bad, Houston, we have a problem.